A new law tightens regulations on a medical resource for drug addicts. Good evening, I'm Latricia Thomas.
I'm Josh Rowe. The statewide initiative will provide more oversight to opioid treatment clinics. Kelsey Bagwell tells us why. Kelsey.
Josh, Latricia, Tennessee is high on the list of states gripped by opioid abuse. People try to break free from their addiction by finding help at licensed facilities. But there are some clinics in the state that are not properly licensed and could do more harm than good. Dr. Alexander Zotos helps people battling opioid addiction.
You're dealing with people's lives. Addiction is a progressive and fatal disease. It may not happen overnight, but left untreated, it can lead to death.
He says in 2015, 22% of deaths in Tennessee were drug overdoses. And worse, he says some of the clinics addicts turn to change their lives made matters worse.
This arose from complaints from the community, from law enforcement, and from other physicians getting complaints from patients, whether it was people charging exorbitant amounts, turning their back on patients if they couldn't pay. That kind of thing.
A law that went into effect Thursday forces treatment facilities offering Suboxone to become licensed. Suboxone is a drug that weans patients off opioids without withdrawal. The state will do random checks of the clinics to be sure they're following the rules. Dr. Zotos says regulation is crucial for recovery.
It's no different than a surgeon following what is the standard of care approach.
Dr. Zotos is on the board at CADIS, an already licensed Chattanooga treatment facility. Zotos says all doctors and clinics that offer treatment should be held to the same high standard.
This is a good thing. It's going to raise the bar. It's going to overall change the way we do addiction treatment. And I think in the end, it's going to benefit the patients.
Methadone is a pure replacement of the drug and has its own set of rules. There are a lot of resources available to addicts seeking help. You can find some of them on our website, NewsChannel9.com, under this story. Josh.
Kelsey, thank you. Chattanooga's Council for Alcohol and Drug Abuse Services was one of 3 clinics in the state to receive funding to fight the epidemic. They were given $800,000 to do so earlier this year.